Hello teacher, hello student. My name is Jorge Reguizala. My topic is Bitot stop definition. When shape early spots white triangular shape appears on the conjunctiva is a severe vitamin A deficiency, especially in children. Application in medicine, zero ulmia progress, proheli, and the first sign hemerolopia, or Nike, blindness, subcutaneous conjunctival cirrhosis, top spots, corneal cirrhosis, corneal ulcerations, and keratomalacia, softened cornea, with subsequent rupture of the eyeball by appears. The top spots are not specific, seen, but are not always present. In younger children, there may be a rapid progression to keratomalacia. In endemic countries, the diagnostic vitamin A deficiency remains clinical depending on the degree of xerophthalmia, hemerolopia, and Bitot spot should be as significant at slow weight and height in indefinite children in urgent need of medical care.
Ratanu Chandra. I am an assistant professor in the Department of Medicine of Arjikar Medical College, Kolkata, which is one of the largest tertiary care centers of Eastern India. Today, along with my colleague Dr. Uddalak Chakraborty, I am going to present an interesting clinical picture of dryness and itching in eyes along with bilateral Bitot spots in a 26 years old lady. There was no clinical evidence of malabsorption, cholestasis or chronic liver disease. On ocular examination, there was bilateral triangular foamy keratinized spots suggestive of Bitot spots, and according to the WHO classification, it was xerophthalmia stage 1B. The basic blood parameters along with the stool examination for ova, parasite and cyst did not reveal any abnormality. The patient was started on oral vitamin A supplementation in the dose of 10,000 units per day for 3 months, and within the first month of therapy there was remarkable improvement in the signs and symptoms. Now the Bitot spot had been considered to be a pathognomonic sign of vitamin A deficiency, and in medium to low income countries it is used to estimate the prevalence of vitamin A deficiency, and in developing countries such as India the prevalence of subclinical vitamin A deficiency is up to 61%, and once the blindness develops, the mortality secondary to vitamin A deficiency may be up to 40%. So, it is very important to recognize the early clinical symptoms and signs of vitamin A deficiency to prevent this reversible cause of blindness. Thank you.
Pros and cons. Pros. Treatment is based on the administration of vitamin A orally in adults according to the age. Modern forms such as hemerolopia and conjunctival cirrhosis can be reversed after 4 days of treatment without leaving and sequelae and control of the administered dose must be kept to avoid overdosing. Cons. The deficit is to a low intake of nutrients aggravating diarrhea, infection, and parasites, which increments the needs and degrades the absorption of the vitamin patient can increase demand by up to 3,000 AU. They seeds lack of vitamin A is the cause of more than half of the blindness associated with these leaves. Applied in Ecuador. In mid 100 1993, Ecuador Health Research Institute conducted a survey to evaluate the general nutrition and vitamin A status of children in 5 provinces, 3 in the mountains and 2 on the coast. Of the 1,232 surveyed children of serum retinol levels were measurably 18% and 2% were found to have levels below 0.7 and 0.25 mol respectively. Low serum retinol levels were more common among children of mothers who had relatively late education and resided in rural areas. The presence of dog spot was confirmed into the study. Conclusions: prevention is essential to reduce cases of blindness and death associated with deficit. The systemic and periodic administration of high doses of vitamin A during the first years of life is a measure that has been shown to be simple, low cost, and highly beneficial in the short term.
Definition, then we will try to identify the spots in eye. We will review WHO grading of xerophthalmia, in which grade it fits, and finally a case along with its treatment. Bitot spots are small triangular white patches resembling dried foam on the outer and inner sides of the cornea. Foamy appearance of Bitot spots is due to gas production by Corynebacterium xerosis. Pathologically, Bitot spots are metaplasia of the conjunctival epithelium and tangles of keratin admixed with gas-forming bacteria. Corynebacterium xerosis is the culprit, giving the lesion its characteristic typical foamy appearance. Now let's start with our case. 4-year-old male child weighing 11 kg was brought by parents with complaint of muddy discoloration of both eyes for 1 month. Now let's see WHO grading of xerophthalmia. XN is night blindness. In fact, night blindness is the first symptom of vitamin A deficiency. X1 is divided into X1A and X1B. X1A is conjunctival xerosis, and when conjunctival xerosis is associated with Bitot spot, it is X1B. X2 is corneal xerosis. X3 is divided into X3A and X3B. When corneal ulceration involvement is less than 1/3, it is X3A, and when corneal ulceration involves more than 1/3 of cornea, it is X3B. XS is corneal scarring and XF is xerophthalmic fundus. Now let's see treatment case. It should be remembered that any stage of xerophthalmia should be treated with 60 mg of vitamin A. Same dose is repeated next day and after 14 days. In patients 6 to 11 months of age, dose